Welcome to the Killer Boobies podcast, Unraveling Breast Implant Illness. Here's your hosts, Wendy Bunnell, Leslie Smoot, and Brandy Vega.
Today we're talking about the history of breast implants, and we're talking about how they became so dominant in the market. I have Dr. Ryan Spivak here with us to give us a little bit of that story.
Hi, Leslie. I'm very excited to be here today. It's Dr. Spivak again. Myself and my, co-founder, Dr. Daniel Suissa, started Squlpt, and Squlpt is a big supporter of Killer Boobies and all of the movements out there to help women with issues related to breast implants and finding better alternatives. So I'm excited to talk about that today.
We're really interested in getting into this topic of how did breast implants come about? And, I think it's interesting to hear a doctor's perspective.
Okay, cool. So the basic history of breast implants and how they got to be so big.
Mm-hmm.
Okay, so it all started really in the 1960s. Two plastic surgeons in Texas came up with the idea of using silicone or a silicone shell as a breast implant. Now, a little bit of background about this. Plastic surgeons have been trying all kinds of crazy things. And surgeons, because, all surgeons have been trying all kinds of crazy things to put things in women's breasts to make them bigger. This is like sponges, rubber, like anything you can imagine had been done.
Oh, wow.
And what happened is the surgeon that came up with the idea, Dr. Garau, was, I guess, operating one day, and he saw a saline bag filled with fluid, an IV bag.
Mm-hmm.
And he said, well, what if it was kind of like a plastic shell and there was saline or silicone in it or whatever, and maybe that would work. And so they actually created a prototype and presented it to the company Dow Corning, which was the biggest silicone manufacturer in that time.
Mm.
They did some studies. They put it actually into a dog first.
So the first living creature that received silicone implants was a dog?
They did a breast augmentation for a dog. I think the dog's name was Esmeralda or something like that. And, this dog had breast implants. Anyway, so that was the first trial. And then they actually tried it on a woman down in Texas. And she was the first one once they had the prototype done. And that was the beginning of the craziness.
So they put him in this woman in Texas, and I guess that went okay.
That went really well, right?
Okay.
And all of a sudden, that was the eureka moment for silicone or saline breast implants. And literally everything from there was just like this. And why is that? Well, at the end of the day, you go from something like this to something like this. It's immediate. It's actually a relatively simple operation as far as from a plastic surgeon's perspective. There's a lot of nuance, etc. But, in a 1 to 2 hour operation, you have this instantaneous result right out of the box. It's built for modern society, right? No work has to be put in, no consideration, just, okay, sign me up. I'm going to go from this to this.
Well,
and it just blew up into the biggest thing you can imagine.
Yeah. Well, especially because a manufacturer is making it. They can make lots of them. They can ship them around the globe. You can keep it on your shelf, so to speak, and then implant them when your client is ready. So it's an ideal scenario.
Ideal scenario. And these implants were actually put in for upwards of 23 years before the FDA even started to review them.
What?
So this was going on. This was pre-FDA approval for them.
Whoa.
It was a different era.
Yeah.
And so it just, there was no real studies. There was no evidence. No one was following up on things. The research was very poor. And so you had 23 years of unfeathered growth. And so what happens as a result of that? I'm just having some water. As a result of that, you have an entire era of plastic surgeons getting trained how to do this. And then that era and generation trains the next generation.
Yeah.
And then that next generation in the 90s and 2000s is, all of a sudden has this whole armamentarium. There's multiple companies, right? There's, I'm not going to mention the companies, but there's, 3 to 4 different major companies with
Sure.
all the different fancy names, the models, this side, that side, this one's a better gel, that one's not a better gel. And you have this armamentarium and a new generation of surgeons that literally grew up with it like it was completely like the most normal thing in the world, right?
Oh yeah. Yeah. It became so normal. Mhm.
And it grew into worldwide prominence, and it became a $1 billion plus industry.
Well, and from a female's perspective, it solved the problem. For any
Very
woman,
well.
for any woman that had any deformity, any misshapedness, lopsidedness, or whatever, if she was flat, it solved the problem. And so it follows that perfect formula of what problem is the world having and can you solve it? And if you can, bingo.
Exactly. And, let us note that it did a wonderful job for a lot of women with breast cancer, especially,
Yeah.
right? So who didn't always have other viable options. So putting that out there as well, it definitely helped a lot of women on that end. So,
Mm-hmm.
and then, now it brings us into the modern era. So you have 25 or 23 years, no, research at all, just putting them in. FDA finally gets involved. Implants are taken off the market, put back on the market. I'm not going to get into every gory detail, but basically they did safety reviews, and those safety reviews were related more to rupture or the actual implant breaking.
Sure. Mm-hmm.
That was their main reason to do the safety reviews,
Mm-hmm.
right? And if it did break, are people like dying from it, right? Like, how bad is it? And so that was the main reason to re-review the implants. But on a low level of all this, there were these indications of autoimmune problems.
Right.
And that was kind of just simmering under the baseline as implants were getting re-reviewed, restudied, re-reviewed, relaunched, remarketed, redone. And so you have this like little thing in the background, right? But no social media,
Mm-hmm.
which really allowed women to put their voices together. And I think we can touch base on that. But
Yeah. Back then, I do actually remember there was a woman, and I wish I could remember what year it was, but she showed up on Oprah and she stood up in the audience and she started to cry because of all the health problems that she had. Back then, that
right,
was the only outlet. That was, if you could get on television, if you could get in front of a news reporter, it was your only way to have a voice and to get out to the masses. And so so that voice was heard, but most women's voices were not heard. Not only that,
correct.
but I do also know, just from researching this myself, that when women would sit down and talk with their doctor, they would say, but are you having pain in the breast area? And they would say no. They said, then it's not relevant. And so any other complaints were dismissed. So when you talk about the little
That
conversations underneath,
simmer. Yeah,
it was dismissed. And it's easy for a person to listen to a doctor, tell them that it's not relevant, and say, oh, okay, well, then it must not be relevant.
right. It must be something else.
Let's discuss the risk factors that came along with breast implants and the autoimmune problems that also came along with the implants.
Okay, cool. So from the beginning, when they started to do the studies, there was always an indication that silicone breast implants, and remember, when I'm talking about silicone, you also have to remember that even saline breast implants also have a silicone shell.
Mm-hmm.
So they're really both of them, no matter which one it is. Obviously, silicone has, way more silicone in it, and saline has less, but they both have silicone components. Okay, fine.
Thanks.
In any case, it was always apparent, and there was always really good, there was always solid evidence to indicate that breast implants were associated with autoimmune conditions. But in teasing this out, it relates to a couple of things. What they looked at is major autoimmune conditions. So, like, you get breast implants in, and you get this incredibly rare autoimmune condition, and there's an association. So these are conditions called Sjogrens syndrome
Mhm.
Wegener's granulomatosis,
Mhm.
scleroderma,
Mhm.
rheumatoid arthritis, like the big players, right?
Sure.
These are clinical diseases with very specific criteria. They have markers in your blood that you can test and study for. This was the things that they were really looking for. And it was always apparent that there was an association. So if you're a woman who never gets a breast implant, and you're a woman that does get a breast implant, the woman that gets the implant has a higher associated risk of developing one of those conditions. But here's the issue. The conditions are so rare in general, so incredibly rare, that even though there was an association, it was not a reason to prevent the implants from getting approved. Does
Yep.
that make sense?
That
Because
does
it
make
just wasn't affecting enough people.
Mm-hmm. And remember, if you have a connective tissue problem, you're going to a doctor that specializes in connective tissue disorders.
Right.
Nobody's really looking or adding up the different doctors that women were going to.
Correct. So, everyone was like, okay, it's there. But again, we're really kind of focusing on ruptures. And if someone ruptures and silicone gets everywhere, are they like dying from it? That's not happening either. And that was it. They approved it, right? But here's the key. As we know, breast implant illness is not Sjogren's syndrome. It's not scleroderma. These are like to the
Big.
most severe level. It's a spectrum. And that's the hard part about autoimmune conditions. Everybody sits on a spectrum of severity. Some people have mild symptoms and some people have it really severe, like those big diagnoses that we talked about.
Mm-hmm.
So as a result of that, throughout all of these eras, these women were having symptoms of breast implant illness, which were things like, again, chronic fatigue, low energy, brain fog, neuropathy, rashes, recurrent infections, muscle aches and pains, right?
Yeah, the digestive problems are really big
Exactly.
also. Mm-hmm.
I mean, I'm listing a few of the major ones. There are a lot, right? So I'm not
Mm-hmm.
by no means discounting anything. But there was no voice for anybody to put this together, right? And then finally you hit the 2010s, and finally women started to put this together, and women's groups such as Healing Breast Implant Illness,
Mm-hmm.
the Facebook group, the internet site,
Yeah.
really put all these women's stories together. They were able to develop a voice. And for the first time, I mean, almost 55 years later, from the first woman who had a breast implant placed, we finally realized actually there's a major thing going on. Isn't
Right.
that crazy? 55 years, almost 60 years later.
Yeah, I think to me, that just speaks volumes. And what it means is that stuff gets put on the market and it hasn't been studied. And so there will always be a lag time from the time it goes out and it's very popular to the time that the studies can now give us an assessment, a clear assessment of what it does to the body.
Absolutely. And so, there's a lot of new research coming out now. I just read a study from Israel.
Mm-hmm.
I thought it was a really good one. They looked at 100,000 women that never got implants, and they looked at about 25 to 30,000 that did get implants. And they looked at all the autoimmune conditions and that were associated with it, because they have a socialized medicine system. So they have good records and things.
Yeah.
They were actually able to review it. It was
Mm-hmm.
done by a rheumatology department,
Mm-hmm.
internal medicine. And again, very clearly shows a direct link, where you have a hazard ratio, which means your ratio of having something bad, i.e. the autoimmune conditions, is 45% higher for women who have implants.
Okay,
And
so
that's also just for the major things. They're not really even able to tease out all the other symptoms, but you can only imagine that along that spectrum, it's a pretty significant amount of women that can have this.
right. So I just want to restate that. So the autoimmune risk is 45% higher in women with breast implants compared to the general population, based on that study that they did in Israel.
Right. And that's risk. That doesn't mean 45% of the women are going to get it. It just means that there's an associated risk.
Great.
More research is needed to be done.
Yeah. Okay. Thanks for pointing that out, because sometimes we start thinking 45% means 1 out of 2 women, right? But it's a
Correct.
risk, and we just need to make sure everyone understands it's a 45% increase in risk. And there are a lot of things, not just breast implants, that make it so that you would have a tendency to get autoimmune disease, such as the family history. Do you have a genetic predisposition? Are you low in vitamin D? Are you malnourished? I mean, there's a whole bunch of other contributing factors that can create the cascade of autoimmune problems.
Right. And so I actually looked at another recent paper discussing that. They postulate and have looked at some good research saying that if you have had an implant in the past, you're at higher risk of developing implant-related autoimmune conditions. If you have allergies, like latex allergies, you change your laundry detergent, or and all of a sudden you get a rash all over the place, and you're prone to like rashes and dermatitis and things like that, it means your body's pretty sensitive to being exposed to different products and chemicals, higher risk.
Yeah.
Obviously, if you have any history of rheumatoid arthritis or other autoimmune issues, higher risk, right? So those are some of the things that they postulated would put you at an increased genetic risk.
It would be interesting if we pull up the list of symptoms of someone with Sjogren's syndrome and rheumatoid arthritis, just so that people can see that if there's a 45% increased risk of having these problems, that they can actually see what those problems are. Okay, so here's Sjogren's symptoms: brain fog, fatigue, chronic cough, vaginal dryness, dry eyes, dry mouth, dental problems, swollen glands, aches and pains in joints, fingers, wrists, ankles. I would add knees, dry, itchy skin, numbness, or other nerve problems.
This is a pretty amazing slide because, I've also looked at some other studies about talking about the most common symptoms you would have with an implant-related illness, right? Breast implant-related illness.
Yeah.
And some of these are completely like right on T. So one of the most common was aches and pains in the joints. Technical term, arthralgias. Basically, my joints hurt, muscles hurt, right?
Yeah.
That's part of Sjogren's. Other ones, dry eyes, fatigue, brain fog. Dry mouth, dry eyes, brain fog, fatigue, and then the numbness or nerve issues. So those were some of the most common symptoms also in breast implant illness. And I think it's so important to notice that we talked about a spectrum, right? There is a shifting spectrum in breast implant illness and all these autoimmune conditions. There's nothing really set in stone with breast implant illness, but we know it's on this spectrum. And so you see here that there's like 6 or 7 major symptoms of Sjogren's that are also common symptoms of breast implant illness. So again, it's all kind of part of the same milieu.
Yeah. And, it's funny because I didn't look at Sjogren's syndrome until after I had my explant surgery, because I was just so eager to get it out. Yeah, I just wanted to start getting better. But then I look at this chart and say, wow, 100%, check, check, check. I had literally every single problem on that chart for Sjogren's syndrome, but I had never gone to a rheumatologist. I had never thought about going to a rheumatologist. But the good news is, once I got my implants out, a lot of those problems subsided and went away completely. So that is remarkable. And that's why there are so many of us in the breast implant illness group trying to be advocates and letting women know that, hey, if you get rid of the implants, you're likely to get rid of a large part of the problems that you're suffering from.
And that's exactly right. And in fact, there are research studies that show that. There are studies of hundreds of women, and they studied, their symptoms before and after, and there was a 60 to 80% improvement in symptoms of breast implant illness. So there is direct research. And I can say anecdotally that every woman that I've removed an implant and the capsules with have all gotten better. Different periods of time, some really quickly, some take 6 to 9 months.
Right.
But everybody had some immediate improvement in symptoms.
Yes, and that's pretty remarkable, and it's a huge blessing. I'd like to share this other chart for the rheumatoid arthritis. Numbness and tingling of hands and feet, joints
Check.
feel warm to the touch, disrupted sleep, low-grade fever, fatigue, depression, mood changes, dry eyes and mouth, weight loss, joint pain, swelling, stiffness, pain that starts in the fingers and toes and spreads to other joints. The joints look red and discolored, and pain in the big toe. Anyway.
Yeah, I mean, these are all exactly like Sjogrens on the spectrum with breast implant illness. I'm not sure about pain in the big toe.
What's really interesting, Ryan, when I talk to the women who have had breast implant ruptures, their pain in their feet and their ability to stand long on their feet is impacted. They
Wow.
don't like to be on their feet. They have to get down. They have to get their feet up. Their feet hurt, and they do have problems with their toes. So I don't know if the rupture makes it worse or if it's just more pronounced in certain people. But
Yeah, and that kind of actually makes sense, because if you're having joint pain, and that's the joint, the joints in your legs, knees, and feet are getting the most wear and tear of your body every day, right? You're standing, you're using them to support yourself, so it makes sense. I just thought it looked a little funny when it said pain in the big toe. Honestly, this is a pain in your whole body that these things can cause. So
some of us say that about our children.
right, exactly.
Causing the pain in my big toe. I think it's pretty obvious to see why breast implants became so popular. But what other breast augmentation techniques were explored and were squeezed out because nobody was really interested in it at the time?
So I love this part of it. This is a talk, we talked about this. I'm very excited to talk about this part. It's the 60s, breast implants are created, zoom, right? They go off the chart, exponential growth. Okay.
Yeah.
Well, in the background of all this, there are other techniques being developed, right? And that main technique is something called fat grafting. And the term fat grafting is now more synonymously known as fat transfer. So fat grafting and fat transfer techniques. Let's talk about that.
Okay.
So a fat transfer or fat grafting technique is, again, where you're going to take fat from a certain area of your body. Could be anywhere that there is, fat deposits. You're going to remove it, you're going to process the fat, and you're going to re-inject it to another area. The way that it works is that fat that's moved from one area to another, your body regrows a blood supply into it and makes it permanent in its new location.
Transplanting a tree.
Yeah, you're
or
taking,
a plant.
And that's actually really interesting that you mentioned that, but grafting techniques were used by gardeners, right? Bonsai trees, gardeners, flowers, and in the agricultural industry for thousands of years. You take something from here, you replant it over here. So that's exactly what a fat transfer is. And that seedling or that graft of a plant grows new roots into the soil. And so the same thing with the fat transfer. Your body grows a new blood supply or new roots into the fat, and it stays permanently. Okay, so cool, right?
When was fat grafting invented?
The first two fat transfer techniques were actually done in the 1800s.
Phenomenal. That's a long time ago.
Yeah, I think it was around 1850s and 60s and 70s. So check out the first two. So the first one, there was a patient, this was all in Europe. There was a patient who had an infection around the eye.
Okay.
And, there were a lot of indents and scars and hollowing out. And then a surgeon took fat from the arm and injected it to the eye to get things to smooth itself out and to correct some of the deformities. Super cool. That was the first ever use. The second ever use was actually for breast reconstruction. In the 1800s, there was a woman who had a tumor removed from her breast. Coincidentally, she had something called a lipoma. A lipoma is a benign fat tumor that's like a big golf ball, okay? It's like a big round thing of fat. It can grow, people get them all the time, actually. They're really minor. It takes like no time at all to remove them. Happens all the time to people. Well, this woman actually coincidentally had a pretty large one, I think, on her back.
Okay.
And so the surgeon took out this ball of fat took out the tumor on the breast, took out the ball of fat, and actually transplanted the ball of fat to the breast. And that was the second use of fat transfer techniques in history.
I'm sorry, that is genius. That was a good consideration. And it worked.
Really cool,
huh?
right?
Yeah, and it worked.
We don't know if it worked. There's really
Oh.
cool, like no one really knows. It probably didn't work that great because you can't just transfer a big glob of fat. Like you have to do really small amounts so that it can take root and your body can grow a blood supply into it. So if you do a big mound of fat, right, your body can only really grow a blood supply into the outside of it.
Oh.
Right?
Okay.
And then the inside of it dies and your body digests the rest, or it causes an infection. So that was some of the issues with early fat transfer techniques. Surgeons didn't have it down pat, and they didn't consider that you had to do really small amounts of fat in like little tunnels or ribbons, I call it, so that your body can quickly grow into it and all of it stays. So the problem with initial fat grafting is they were injecting big globs and hoping for the best. People just didn't know.
Yeah.
Okay, you hit the 1900s, right? And plastic surgeons and surgeons all over the world, and especially towards like the 1960s, 70s, were starting to use fat in small amounts for the first time. So especially in the 60s and 70s for burn injuries, scarring, things like that, they would inject really small amounts and see really nice improvements in scarring and burns and things like that. Okay. It was never really considered for breast augmentation, breast reconstruction, or transferring to the breast for a very long time because they only had success doing these really small amounts. They just didn't have the technique down and they didn't really think of it. But then the big player hits. All of a sudden, there's an implant that you can get out of the box. It goes in. Women do great. At least we think so. No one even, it completely suffocated the development of fat transfer techniques over implants. Implants got there first and they won big. And in that era, you know, fat transfer kind of just slowly became something that was studied more and more.
Right. Yeah.
Okay. So implants are huge, fat transfer is down here. So then we hit the 1990s. And in the 90s, there was an amazing plastic surgeon, Sidney Coleman, in New York City. Sidney Coleman was the first doctor to really create a systematic approach to fat grafting and fat transfer procedures. And he developed his technique, which is called the Coleman technique, which was really the first delineation of how to do it, you know, how to harvest the fat properly, how to treat it gently, how to concentrate it, spin it, add antibiotics, and how to inject it properly, and the entire technique from injecting from multiple angles and doing those really small amounts and building things up. And he actually did it for mostly cosmetic reasons for the face. So, you know, he was a cosmetic surgeon in Europe, and he also did it for reconstructive purposes, but the majority was for cosmetic reasons for the face.
Yeah.
But that technique, and he presented data, and he had photos, and he had proof, and all of that. And then his creation of that systematic process for the first time in the 90s really allowed the technique to explode from there. So fat transfer techniques were 30 years behind the silicone breast implant.
Yeah, that's a big lag behind. But I can also understand because you have an off-the-shelf product versus teaching surgeons a new technique.
That's the breast implant is the easy solution. Fat transfer is a little bit more difficult, right? There's more work to put in. Doesn't come off the shelf, right? Yeah. Okay, so you have his technique. And then finally, plastic surgeons took his technique and started applying it to other areas. One of the first areas it was used for was, again, expanding the use in scars and burn injuries. Yeah. And that then extended to breast reconstruction, using it to improve the health and quality of the skin after radiation, using it to fill in indents, lumps, to improve the results of breast reconstruction. And then finally, surgeons took it to the cosmetic level, and mostly in the 2000s for transfer to the bottom. And that And that was really done in the 90s and 2000s, and mostly in Brazil. And so if you've ever heard the term Brazilian butt lift,
Yes.
it actually involves taking fat from one area of the body and transferring it to your bottom. And that was the first time it was used in a high volume amount.
Right.
Right? You're not just doing a little scar, a little thing on the face,
Mhm.
under the eyes. We're doing a high volume in the tush,
Mhm.
right? To build a new shape, right?
Right.
And so that was really the first high volume use. And then finally in the 2000s, that started to extend to the breast.
That is such a fascinating history. That is a really fascinating history. Now, a lot of the women who've gone through breast implant illness are going to be concerned about the safety. So, have they done research on the safety of fat transfer, or are there any concerns? Are there risks? What do you think?
Okay, great question. So the safety profile of fat transfer is excellent. It's been studied extensively first in women for breast reconstruction. It does not cause increased risk of breast cancer. It doesn't change your ability to do mammograms for regular surveillance after you've had it done. The main risk is a risk of infection, but that is also extremely low compared to the use of breast implants.
Mm-hmm.
So it's very safe.
Yeah.
Like any procedure, there's always a risk,
Yeah.
but the risks are very low,
Yeah.
especially if you're using the proper techniques.
Yeah. Now, since we covered the autoimmune concerns with breast implants, whether it's silicone or saline, have they made any correlations at all between any autoimmune problems and a fat transfer?
Zero.
Hallelujah. That's great. That's
Zero.
great.
It's your own natural tissue. You're just moving something from your body here to there.
Mhm.
There is zero relation to anything regarding autoimmune conditions or the development of them
Well, that's
because
really
it's your
great.
own natural tissue. It's like the perfect
Yeah.
solution.
Yeah. That's really good news for the breast implant illness community, because these are women who have gone from a larger size down to a smaller size. And for some women like myself, I went from a B to a C back to a B. So while it was unfortunate, it wasn't the end of the world for me. But some women who, again, have had birth deformities,
Yeah.
or the surgery didn't go well and they're lopsided, or they went completely flat to an A. I know women who've had the silicone rupture and they're a lot smaller because so much tissue has to be removed once they get that implant that is ruptured out. Same with capsular
Correct.
contracture. So there's a lot of reasons why this is a really good option for people who have had breast implant illness, who have had to reduce down in size, to think that they might be able to do a fat transfer and that they won't have a risk of autoimmune problems.
Correct. I mean, there's the comparison and contrast between fat transfer and an implant.
Mm-hmm.
I mean, implants lose every time. It requires general anesthesia, cuts in your breast, lifting up your muscle, damaging the breast. Putting an implant in causes pressure on your normal breast tissue and makes it shrink and atrophy. There's risk of internal scarring, capsular contracture, which is what internal scarring is, pain, and of course, breast implant illness. Fat transfer has none of those risks. I mean, even the scars are like little freckles because it's an injection at the end of the day.
Mm-hmm.
So a fat transfer procedure almost completely takes all those things out of the equation.
Yeah. What do you see happening in the future? And what sort of things do you think will change in this industry?
So I see in the next 20 to 30 years that fat transfer will eventually overtake silicone breast implants. But we're still 30 years behind the curve, right?
Right.
Everyone's talking about curves right now, right? Flattening the curve, this curve,
Yeah.
that curve. Well, we're working 30 years behind.
Yeah.
But I see a huge sea change in what's going on because I think that, all of the amazing support groups for women out there, such as yours, Killer Boobies, and all the other groups are really giving a voice to problems from implants.
Right.
And at the same time, surgeons such as myself, and Squlpt are trying to offer a better solution.
Yeah.
It's going to take time, but I definitely see it overtaking things. And I'll also say this. I think that the aesthetic is becoming more popular, of not a huge round breast that looks like, Pamela Anderson from the
Mm-hmm.
1990s in Baywatch,
Mm-hmm.
but something that's a little bit more modern, elegant, and balanced for a woman's body.
Yeah.
A
Yeah.
soft, voluptuous look without the hard implant in there. And so I think that the aesthetics are going to change too. And I think that that is going to have a significant positive impact.
Yeah, I would agree. I think in the world of women and fashion, and they just want to look more natural. That doesn't mean no breast augmentation at all, but that might mean something that looks more natural, like you're saying, like the fat transfer. So I'm kind of curious, again, looking at you as a plastic surgeon, and I know that plastic surgeons go to continuing education to keep their license. Is there a lot of education going on currently for fat transfer?
Yes. The good news about it is that for younger plastic surgeons, I've been out in practice for 5 years.
Mhm.
I was trained in the 2000s, right? My training started in 2009. So by the time I entered my training, you know, the technique of fat transfer was a huge part of my training, right?
Yeah.
Because it's an extremely viable solution for reconstructive and cosmetic. And I learned how to do it with really good training. Plastic surgeons that were trained in a different era, the 80s, 90s, and perhaps early 2000s, didn't have as much exposure to this. And so I think on a positive note, you have a new era of plastic surgeons that are way more comfortable with this technique and see it as a very viable solution. So
Mhm.
I think that training wise, the techniques of fat transfer and fat grafting are being taught on a level that they have never been taught before, way more effectively. And you have a new era of plastic surgeons coming out that are going to embrace this more than ever before.
Yeah, I think it's great. And it's an important question for a person to ask their doctor. How much experience do you have in this technique that I'm interested in having done? Look at the
So,
before and
so
after photos too.
yeah, totally. So this is super important, right? So the technique and experience is literally everything, and especially for fat transfer.
Mhm.
If you go to somebody who doesn't do fat transfer procedures often, I can guarantee you the results are going to be 30 to 40% less. And so sometimes, when we put up our before and afters on our site, for Squlpt, people are like, wow, I heard my friend did this and it didn't turn out so great.
Mm.
Right? And we get that all the time. And the answer is, well, where did your friend go? And at the end of the day, a lot of plastic surgeons do a little bit of everything. So your average plastic surgeon is doing Botox and fillers one day, some laser treatments and peels another, a breast augmentation with silicone implants the next week, a tummy tuck, you know, nose job, facelift. I mean, they practice in a very general manner, which is great. Okay. But
Mhm.
you need to be able to do this all the time and have a wealth of experience, because little subtle factors play a big effect. How the fat takes, how much is used, where it's placed properly, huge variations.
Mhm.
And so I do these operations, sometimes there have been weeks where I've done 6 or 7 in a week,
That's
you
great.
know,
Yeah.
and you do that over a month. I mean, I've done this perhaps about, for fat transfer, probably about 500 times, and the other procedures involved with it over 1,000. So
Mhm.
that's a huge wealth of experience in honing what you're doing. I think that is the most important factor in how you should find somebody. So don't go to a plastic surgeon that does, a smattering of it here and there. Go to someone that really does it all the time.
Mhm. And you definitely have before and after photos. What about the opportunity for a woman to talk to someone who's been through it? Is that something that's allowed, or do the HIPAA laws restrict it?
Okay, so that's a great question. So I love setting that up. I think that one really cool thing is most women who go through this are really willing to talk to other women.
Yes.
So at Squlpt, we have like a roster of patients who've had a variation of many different procedures done. And I love connecting them to somebody coming in new, and then connecting them with somebody who's gone through it all. yeah, if the previous patient allows it, there's no HIPAA restrictions at all. You just have to have approval from both parties and you're good to go. So I love that. I try to be a matchmaker, you know?
Yeah, I think that's great because it's really reassuring to be able to talk to someone who's been through it, find out what their experience was, and it just calms the nerves down a lot. And you want to be educated. We keep pushing this. You need to be educated before you go in and have a procedure done. So I appreciate that as a doctor, you're willing to connect the women so that they can hear it firsthand from a patient. And you just don't feel like you're getting marketing material when you actually talk to a person who's gone through it. So that's good.
Yeah.
Well, it's time to wrap up our show, but I just want to give you an opportunity to talk about your office as a silicone-free zone, because the only breast implants you have in the office are the breast implants you use for toys. Is that right?
When we say toys, let's be clear that, mostly just paperweights and stress balls. Those are old ones that I kind of keep around because I think it's good for educational purposes.
Mm-hmm.
But yes, at Squlpt, and our practice is Squlpt, Squlpt or Squlpt Body Shaping. We are a silicone-free zone. So my partner, Dr. Daniel Suissa and I, we've put our foot down. We don't do implants. They're banned. Silicone-free zone. We take them out and we treat women who need them removed, and we fix women who have problems from implants. And we also take on women who are looking for a first-time breast augmentation. You can trust that we have no hands in our pockets from the industry. We're just about supporting women, helping women get through this process, and doing it in a better way. So we are extremely proud of that.
As you should be. And we're happy that you're doing that. And thank you for the education you gave us today on the history of breast implants. And thank you for providing other options for women who don't want to get breast implants. So we hope you have a great day today.
Thank you, Leslie. It was a pleasure.
Thank you for listening. Spread the word by subscribing, liking, and sharing the Killer Boobies podcast today. You could be the person who helps someone reverse their pain and suffering and reclaim their health today.